Active isolated stretching is a new wave of stretching which has taken the world by storm. This technique was created and perfected over the last 30 years by world-renowned therapist and author Aaron Mattis. Aaron's concept is based upon the reciprocal innervation of muscle tissue. This agonist-antagonist stretch reflex allows one muscle group to contract, stretching another muscle group. The stretch is only held for a maximum of 1.5 to 2 seconds, allowing the stretch reflex to work properly. This technique is currently being used by therapists, doctors, and nurses around the world. The fame and rave of the technique has come from the success generated by competition in the Olympic, professional, and amateur ranks. Athletes and therapists have both found the tremendous decrease in the amount of injuries that occur after using AIS stretching technique. With this tape, you will now have the tools to increase your skills as a therapist or maximize your athletic potential using active isolated stretching. Begin a relaxing semicircular motion, moving the head in pendular movements from side to side. Move head in half circles. Begin by lowering the head toward the sternum. Move the chin toward the top of one shoulder, then lower the chin to the breastbone and move to the opposite shoulder. Extend the head backward by contracting the extensor muscles. Assist at the end of the movement with the hands, under the outer borders of the jaw or on the forehead. Do not extend spinal areas below the neck. Stretch the flexor muscles, release to a neutral position, and repeat. For those with disc involvement or following whiplash or severe trauma, hyperextension is more appropriately performed in a prone position. As you begin, tuck the chin as close to the neck as possible. Assist terminal movement with hands on the back of the head. Release and return to a neutral position. Do not allow the spinal areas below the neck to bend downward as the head moves forward. To stretch the lateral muscles on the side of the neck, contract the same cervical lateral flexors on the opposite side of the neck. Move head to the side that you are stretching, and at the end of movement, assist with the hand placed on the side of the head. Focus on an object directly in front of the eyes to prevent movement out of the correct frontal plane. Stretch and return to a neutral position. Rotate the head at 45 degrees to the left. Then move the head at a 45-degree angle towards the right breast by contracting the right side sternocleidomastoid and prevertebral muscles. Assist the movement with the right hand. Do the same thing when going to the left side. Rotate the head at a 45-degree angle to the right, then move the head downward at a 45-degree angle to the left, assisting with the left hand. To strengthen these muscles, rotate the head 45 degrees, then extend backwards at a 45-degree angle. Move the head towards the ear at the outer border of the scapula in the direction the head is rotated. Assist the movement gently with the same sized hand. Return to a neutral position and rotate the head in the opposite direction and move the ear toward the outer shoulder blade. Rotate the head to the left by contracting the opposite side cervical muscles. Assist at the end of the movement by placing the hand along the right side of the jaw and right hand on the left side of the head towards the back end. Avoid any compensation by shrugging shoulders or rotating the upper trunk. Move the head in half circles. Initiate the movement by lowering the head toward the chest. Move the chin towards the top of one shoulder, then bring it back down to the sternum and move it to the opposite shoulder. Repeat the sequence in the opposite direction. The exercise is performed in a 4-point position on the hands and knees or prone with the head extending beyond the edge of the table or bed. Initiate the exercise by lowering the head toward the surface, then extend the head upward as far as possible without extending the middle or thoracic lumbar spine. Assume a side-lying position and then move the head downward toward the lower shoulder and upward toward the top shoulder, giving a gentle stretch to the muscles at that point. In a side-lying position, this exercise is performed from a downward rotated position. Slowly rotate the head upward and to the right. Stretch gently at the top of the motion. The exercise is performed in a supine position. Retain the shoulders on the table throughout the exercise. Tuck the chin as close as possible to the neck. Lift the head as far as possible in a close tuck. You may provide aid at any point throughout the range or at the end of movement with gentle assistance with your hands. Circumduction increases the circulation in the shoulder complex and arm. Perform arm circles toward and away from the midline of the body. Arms should hang like wet noodles when doing bent over circumduction. Lean forward, bend the knees, and tighten the stomach muscles. Begin with small circles and increase with size. Place the palms forward with arms 8 to 12 inches below shoulder height. Reach backward, keeping the arm straight, and draw the shoulder blades or scapula as close together as possible. Return to starting position with palms together. Repeat exercise raising the level of the arms with each repetition in order to include the upper pectoral fibers. Stand or sit erect. Keep the arms close to the side. Reach both arms back as far as possible. Release and return to the starting position. Following the single arm shoulder hyperextension, clasp the hands, palms facing away from the body, which will help keep the shoulder blades apart, and keeping your elbows extended, reach back as far as possible without bending the trunk forward or allowing the shoulder blades to come together or abduct. Release and return to the starting position. The purpose of external rotation is to prevent rotator cuff strain and increase the range of motion for sports activity. Keeping the arms or elbows level with the shoulders, bend the elbows at a 95-degree angle. The palms are facing downward as the exercise begins. Rotate the humerus backward externally as far as possible, contracting the external shoulder rotator muscles. Perform a slow, steady stretch at the end of the movement. Rest on a table or other support surface to assist with the opposite hand. A rope may be gently used for aid with the opposite hand assisting. Lower to the starting position and repeat. Bend the elbows at a 95-degree angle, level with the shoulders, palms facing forward. Rotate the shoulders or humerus forward internally as far as possible by contracting the internal shoulder rotator muscles. Perform a slow, steady stretch at the end of each movement. You may support your elbow on a table or other support surface to assist with the opposite hand. Release and return to a starting position. Athletes are often limited in internal rotation, sometimes resulting in a rotator cuff injury from throwing. Use a rope or a band to help aid in the stretch with the opposite hand assisting. Maintain a straight elbow and keep the shoulder parallel. Reach the arm toward the opposite corner of the opposite shoulder at the top of the shoulder, contracting the anterior shoulder muscles. You may be most effective if maintaining the same side scapula against a surface. Be sure the exercising arm clears the top of the same side pectoral muscle tissue. Reach around to the opposite side of the neck. Walk the fingers down the upper back as far as possible. Place the free hand on the elbow of exercising arm for gentle assistance at the end of movement. Return the arm to the side after each repetition. Do not allow the exercising shoulder to shrug or move forward during exercise. Place the arm in a vertical position with the elbow extending and the palms facing toward the body. Move the arm downward diagonally toward the front of the opposite shoulder. During last few degrees of movement, rotate the shoulder inward for maximum stretch. Use opposite hand to assist the stretch effort. Begin with the elbow flexed 90 degrees forward from the vertical position, palm facing toward the midline of the body with the elbow flexed. Extend the flexed arm forward as far as possible and assist the stretch gently with the opposite hand, or rope to prevent stress on the neck or opposite shoulder. Return to the starting position after each stretch. Lack of full forward elevation contributes to many shoulder problems. The arm should be able to reach a complete vertical position without bending the elbow. From a sitting or standing position, reach one arm forward directly over the top of the shoulder as far as possible. Keep the palms facing the body and the elbows extended throughout the movement. Counterbalance the spinal extension or low back compensation by contracting the abdominal muscles and reaching the opposite arm as far as possible. You may alternate left and right arms. It may be necessary to stretch the triceps first in order to achieve the maximum forward elevation. This movement provides maximum upward rotation of the scapula, permitting maximum sideward elevation of the shoulder complex. The palm is facing forward with the elbow locked throughout the movement. Reach upward as far as possible. Cross the arm and back of the head, reaching across the midline. Assist with the opposite hand, elbow locked throughout the movement. Assist by clasping the elbow with the opposite hand. Return to the starting position after each repetition. Position the upper arm vertically against the neck, palm facing the body. As the top arm reaches over and downward, the triceps, serratus anterior, and upper pectoral fibers are stretched. The opposite hand, palm facing away from the body, moves up the spine between the shoulder blades, attempting to clasp the top hand. Extend the elbow with the triceps brachii muscle to stretch the biceps and brachioradialis muscles. With the palm facing the body midline, ulnar flex the little finger to stretch the brachioradialis muscle. Use the free hand to stabilize the elbow. Return to the starting position and repeat. Flex the elbow Adduct the shoulder and keep the elbow against the trunk throughout movement. From the neutral position, thumb upward, rotate the forearm inward to palm facing downward position. Clasp just below the wrist with a free hand for a slight assistant stretch. Flex the elbow 90 degrees, adduct the shoulder, and maintain the elbow against the side of the trunk throughout the movement. From a neutral position, rotate the forearm outward, moving the palm upward and pointing the thumb downward. Straighten the elbow with the palm facing downward. Extend the wrist and fingers backward as far as possible by contracting the wrist finger extensors. For a gentle assisting stretch, use your free hand and finger muscles. Place the free hand over the palmar surface of the exercising hand, covering the base of the fingers toward the bottom finger surface. Make sure the fingers continue to extend as the free hand assists. Extend the elbow and face the palm upward. Extend the wrist and fingers back through the full range of motion by contracting the wrist finger extensors. Assist at the end of the movement with a free hand by placing it over the palmar surface of the exercising hand, covering the base of the fingers toward the top of the finger surface. Extend the elbow. Slowly flex the wrist downward by contracting the wrist flexor muscles. Apply gentle stretch with opposite hand. The arm position may be lowered to reduce shoulder stress. For a maximal stretch of the finger extensor, flex the wrist maximally. Then flex the individual finger as far as possible, and finally assist with the opposite side thumb. Release to the starting position and repeat. From a standing or sitting posture, extend the elbow and make a firm fist. Flex the wrist downward by contracting the flexor muscles. Flex the wrist as far as possible and assist with the opposite hand. 90 degrees of movement is normal. Extend the wrist and fingers backward and assist with the opposite hand. Release and repeat. For best result, keep the elbow extended. Perform the exercise a number of repetitions from a prone, palm down position, and then do the same from a supine, palm up position. Extend the wrist into adduction by contracting the distal end of the ulna, moving the little finger and remaining fingers toward the same side of the wrist. Assist with the free hand, returning to a neutral position, repeating as needed. Flex the wrist into abduction by contracting the distal end of the radius, moving the thumb and fingers toward the wrist. Movement may be vertical or horizontal. Assisting with the opposite side hand, release and return to a neutral position and repeat as needed. Contract the working extensor muscles of the fingers. Also contract the wrist extensor muscles. Begin with palms facing away from the body and flex the elbows at 90 degrees. To stretch the finger wrist flexors, hyperextend the wrist and extend the fingers and elbows simultaneously. Working with one finger at a time, abduct or spread the finger. To assist the stretch, use the thumb and additional finger from the free hand. Stretch, release, and repeat. Holding the hand at a 90-degree angle with the palm facing away from you, abduct the thumb away from the index finger, assisting with the opposite hand. Abduct the thumb horizontally, moving the thumb laterally away from the index finger. Stretch the web and adductors using the opposite hand. Actively move the thumb over the top of the neighboring index finger. Use the opposite hand to assist the stretch. Release and repeat. Actively contract the muscles of the opposition by moving the thumb towards the base of the little finger. Use your free or opposite hand by placing the thumb on the outer base of the thumb being stretched. Flex toward the little finger, release and repeat. Following this, place the thumb inside the four fingers and squeeze the thumb. Next, ulnar flex the wrist downward and assist with the opposite hand. This is the Williams back exercise. From a supine position, flex the exercising knee and pull it toward the axilla or armpit by contraction of the hip flexor and abdominal muscles. Place the hands behind the thigh to prevent pressure on the knee and provide slight assistance at the end of the free movement. From a supine position, place one hand under or in front of the active knee to help maintain a flexed hip. Flex the uninvolved leg, contract the quadriceps, and extend the knee of the leg to be stretched slowly to full extension. Rotate the lower part of the leg inward while performing the bent knee hamstring stretch. Place the rope under the foot and wrap both strands around the inside of the ankle. Do not allow the upper leg or femur to turn. Rotate the lower part of the leg outward while performing the bent knee hamstring stretch. Do not allow the upper leg to turn as the lower leg rotates. Extend the knee, moving the lower leg to the same side shoulder. Use the rope to assist. From a supine position, slowly lift one leg using the quadriceps muscles. Give gentle assistance with the rope or hands at the end of movement as the quadricep muscles continue to move the leg. If using a rope, walk the hands up the rope, hand over hand, as you lift the leg. From the same position as the straight leg hamstring stretch, wrap the rope under the foot with both strands around the inside lower part of the leg to help maintain an internal rotated position. Lock the knee of the contracted leg and lift with the hip abductors and quadriceps. From the same position as the straight leg hamstring, keep the knee extended and rotate the entire leg outward. Move the leg toward the opposite side shoulder by contracting the inner thigh. Place the rope under the foot and loop both strands around the outside of the lower leg to help maintain an outward rotated position. Use both hands to walk up the rope. When the leg reaches the opposite side shoulder, Release and repeat. From a supine position, internally rotate the active leg, keeping the leg straight. Use the rope looped over the foot on the outside of the heel and around to the inside of the ankle to help prevent external rotation of the hip during abduction. Move the exercising leg as far as possible and return to the starting position. Part 2 of this exercise, you repeat the exercise with the active leg rotated outward 45 degrees, which isolates the adductor mangus completely. Adduct and extend the hip downward from the midline. Part 3, to best stretch the proximal attachments of the hip adductors, turn the leg inward and reach vertical to a position 12 inches outside of the same side shoulder. From a supine position, move the non-exercising leg across the midline underneath the exercising leg. Wrap the rope around the outside of the ankle to the inside of the calf to assist with the gentle stretch. Bring the opposite exercising leg across the midline of the body to stretch out the tensor fasciae lata. From a supine position, stabilize your pelvis by moving non-exercising leg across the midline and rotate the same leg inward extreme. Move the exercising leg towards the bottom of the opposite side breast. Use both hands to assist. From a supine position, rotate the non-exercising leg inward and move across the midline as far as possible to help stabilize the pelvis and isolate the muscles to be stretched. Bend the knee 10 degrees and lift the leg upward as near as vertical as possible. Reach toward the last rib on the opposite side to complete the stretch and return. From a 3-point kneeling position, begin with the weight on the leg to be stretched. Place the other leg 12 inches in front of the lead knee. Maintain of your body in vertical position as you lunge forward slowly. From a side-lying position, move the lower uninvolved leg close to the chest and secure it with the lower arm. Place a rope around the ankle to maintain the knee at a 95 to 100 degree angle. Reach the leg straight backward using the rope to assist at the end of movement. Lie on one side with the lower hip flexed and thigh pulled close to your chest. Maintain the position using the same hand for stabilization. Hand may be placed under the foot of the stabilized leg or around the thigh if you're unable to clasp the foot. To stretch the hip flexor, the end of the erectus femoris, extend the thigh backwards in a straight line of the upper body. Flex the knee with the heel and pull toward the buttocks using the hamstrings. From a supine position, place a rope around the midfoot, bending the knee at a right angle, and clasp the foot with the same side hand, placing the opposite hand on the knee to stabilize the femur. Rotate the hip by moving the lower leg away from the midline and assist at the end of the movement with the rope. From a supine position, flex the knee at 90-degree angle and place a rope around the midfoot, clasping the rope with the opposite hand. Use the same side hand to stabilize the femur, gently clasping near the knee. From a seated location, place a pad under your knees and loop a rope under your midfoot. Keep your buttocks on the table and move the lower part of your leg away from the midline of the body. Assist the active movement with gentle assistance from the rope. Move the thigh farther from the midline as each rotator is released. From a seated position, using a rope looped under the midfoot, move your leg across the midline as far as possible while keeping the opposite side buttock flat on the table. Prevent the opposite side pelvis from lifting. Use the rope to assist at the end of the effort. Begin from an upright sitting position. Being in a chair keeps the muscles of the hip uninvolved. Flex the knees, tuck the chin, exhale, and firmly contract the abdominals as you curl